In the world of medicine, new discoveries are always on the horizon. In 2001, scientists identified a previously unknown virus, human metapneumovirus, or HMPV for short. This discovery marked a significant step forward in understanding respiratory illnesses, particularly in young children. Before its identification, many cases of HMPV infection likely went undiagnosed or were attributed to other respiratory viruses. The identification of HMPV highlighted the complex nature of respiratory infections and the need for continued research in virology. Researchers found that HMPV belonged to the paramyxovirus family, a group of viruses known to cause a range of respiratory infections in humans. This family includes well-known viruses like respiratory syncytial virus, or RSV, and parainfluenza viruses, both of which are common causes of respiratory illness in infants and young children. The discovery of HMPV provided valuable insights into the causes of respiratory illnesses that were previously not fully understood. It underscored the importance of ongoing surveillance and research efforts to identify and characterize new and emerging viral pathogens. Understanding these viruses is crucial for developing effective diagnostic tools, antiviral therapies, and vaccines to combat respiratory infections, especially in vulnerable populations.
HMPV, like many respiratory viruses, primarily targets the respiratory system. This intricate system, responsible for the intake of oxygen and the expulsion of carbon dioxide, becomes the main battleground when HMPV invades. The virus, upon entering the body, often through the nose or mouth, travels to the cells lining the airways. These delicate cells, forming the protective lining of the respiratory tract, become infected by HMPV. The virus replicates within these cells, leading to inflammation and swelling of the airways. This inflammation narrows the air passages, making it difficult for air to flow freely in and out of the lungs. As a result, individuals infected with HMPV may experience difficulty breathing, along with other respiratory symptoms. The severity of these symptoms can vary depending on the individual's age, overall health, and the strength of their immune response. In some cases, HMPV infection can lead to more serious complications, especially in individuals with weakened immune systems or underlying health conditions.
HMPV infections are often difficult to distinguish from other respiratory illnesses based on symptoms alone. This is because the symptoms of HMPV infection closely resemble those of the common cold or other viral respiratory infections. However, being aware of these symptoms can help individuals seek timely medical attention and manage the infection effectively. One of the most common symptoms of HMPV infection is a persistent cough. This cough is often dry and hacking, and it may persist for several days or even weeks. Along with the cough, individuals may experience a runny nose or nasal congestion, making it difficult to breathe comfortably. Fever is another hallmark symptom of HMPV infection. The fever may range from mild to high grade and is often accompanied by chills and body aches. In some cases, individuals may also experience wheezing, a high-pitched whistling sound produced during breathing, which indicates inflammation and narrowing of the lower airways.
While HMPV can infect people of all ages, certain groups are more vulnerable to severe illness. Young children, particularly infants, are at increased risk due to their developing immune systems. Their immune systems are still learning to recognize and fight off infections effectively, making them susceptible to more severe symptoms and complications.
Older adults, especially those with underlying health conditions, are also more susceptible to complications from HMPV infection. As we age, our immune systems naturally weaken, making us more vulnerable to infections. Additionally, chronic diseases like heart disease, lung disease, or diabetes can further compromise the immune system. Individuals with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are at a higher risk of developing serious complications from HMPV infection. Their immune systems are often not strong enough to fight off the virus effectively, leading to prolonged illness and a greater likelihood of complications.